Good morning, Commissioners. Dan Martingale, Public Health Director. Yes, as of yesterday, we have our first confirmed flu case in an adult. It's actually the H1N1 strain. If you remember back in 2009, we did our community outreach and community flu clinics. I want you to know that H1N1 now is fairly common. So at least at this point, nothing to get alarmed about. And this year's flu vaccine actually has the H1N1 covered. So, and I know personally that at least 2 of our commissioners have received their flu vaccine. So, so if you have not, I would urge you to do that. The strain is influenza A for this first one. There's influenza A and B. Influenza A is generally a little bit more severe in terms of the sore throat, aches, fever, those sorts of things. So, but the good news is this is only the first one, and we're well into the flu season here for the 2015-2016 flu season. Just to put that in perspective, last year at the end of the 2014-15 flu season, we had 365 hospitalizations for flu here in El Paso County. So with that said, I think we're doing well. We'll keep our fingers crossed, and everything's going well. I also just wanted to mention community collaboration that we're going to be doing that I'm pretty thrilled about with Peak Vista. We will be working with them and actually have a dental hygienist coming over twice a week to the health department. And what this dental hygienist will do, at least for the first month, and we're starting in January, next month actually, is to allow walk-ins and drop-ins from our regular clientele to meet with this dental hygienist for about 10 minutes. The dental hygienist will kind of do a quick survey, a once-over, give information and information about proper dental care. Then once we kind of get situated, I'm thinking probably in February, Peak Vista said that they'd be willing to offer sealants to the clientele. And all this is preventative. So in other words, if they see that young children or even adults may need something to prevent cavities, they will actually do the sealants at the health department office on the second floor at Citizen Service Center. So I think that this will benefit not only obviously Peak Vista and their clientele, but I think it will add to the traffic for CSC and hopefully for all different programs that we have there in the building. And of course, we're trying to set this up right next to our clinic too on the second floor. So I think that this will prove to be a real exciting and beneficial collaboration that we're going to be having. And then finally, Commissioner Littleton, we look forward to meeting with you, I believe on the 20th. I think our interim medical director, Dr. Turbush, has set something up for a tour and just to kind of reconnect in terms of public health.
Thanks for also mentioning the dental outreach, and I just wanted to point out that El Paso County participates in the National Association of Counties prescription discount and dental discount program, which can be accessed on our website at www.elpasoco.com. It does cost a little bit for the dental program, but the prescription discount program is free to residents, and they can take advantage of that immediately by printing a card online. So to go to the front page of our website, dental has a lot to do with your overall health as well. You can be very affected by health issues if you don't get proper dental treatment, and especially for children, it's extremely important. So I appreciate you bringing that up. And I do note that Danielle sent out a press release yesterday about the influenza. Okay. Can you, because I know Commissioner Lathan and I were able to get our flu shots at the same time, actually a Feed the Children event, and they wrangled us and got us in line. But there's 2 different types of vaccines, is that correct?
Trilivant and Quadrivant. The Quadrivant is the one that you should try to get, because that has more of the coverage for the different strains that may be floating out there. Obviously, when the vaccines are developed from year to year, it's kind of a guessing game. Last year, obviously, I'm sure some people did not get vaccinated, but others that were vaccinated got the flu. And I think a lot of that had to do with just the guessing game wasn't quite on last year. But this year, it seems to be working quite well. So if you're going to, I would, you may be offered at your clinic, tri or quad. I would go with the quad because that covers kind of the whole gamut.
And in the information that the health department sent over, then in 2014 to 15 in the flu season, 340 people in El Paso County were hospitalized due to flu-related symptoms. So this is not the common cold we're talking about.
Right.
This is something much more serious. And it's recommended that anyone 6 months of age and older, and I would expect, especially older adults, should really get those, especially if they're in the high-risk categories. Flu is a lot different than just getting a head cold.
Absolutely.
And so I appreciate it. The flu starts suddenly with fever, headache, tiredness, cough, sore throat, and body aches, and we've all at some point probably been through that, but better to prevent it. And,
Absolutely.
And it says here too that that commonly peaks in January, February, but it can actually continue through May. Is
Absolutely.
that correct?
Yep.
Yeah.
Generally starts September-ish through May. So it's not too late if you have not received it for our community members and elected officials. If you have not received your vaccine yet, I would suggest that you make an appointment and get one. And you're absolutely right, Commissioner Clark, that it's the children and the older adults that are most susceptible. If they do get the flu, it can be much more severe and even life-threatening. So just a word to the wise that hopefully folks are making their attempt to get the vaccine. I will say that I believe we actually vaccinated 110 individuals at the Feed the Children event. So that was good. That was good. So anyway, that's kind of my report, I guess.
Thanks for the partnership as well with Peak Vista. We know we have a really good working relationship with Peak Vista Community Health Centers, and appreciate you continuing to reach out in so many ways.
Thank you, Commissioner Clark. We hope to keep increasing that with new partners as well.